6:31 this morning. With most kids in our area learning in person this year, doctors say it is important that you know when to get your child tested for COVID-19.
So this morning, Dr. Hawkinson from the University of Kansas Health System joins us live to talk more about getting kids tested. Doctor, good morning. Talk to us about how parents should decide if their child needs to get a test. I think pre-COVID, we were all very aware of, oh, school has started, my kid's going to have some sniffles, that kind of thing. Is that something that would make me rush out and get a test if my child comes home with a cough?
Yeah, I mean, I think the first thing to do, if your child is 12 and over, get them vaccinated. Secondly, we know that kids, just as you said, kids do get illness and sick and sniffles, and adults do too, but maybe not at the same rate as children. So it does make it difficult. I think the best thing to do is to go get tested as soon as possible when you do have those symptoms present. You can get those home tests. They are pretty good sensitivity and specificity for being able to pick up disease. But we also know for those home tests, even if it's negative and there are symptoms, you should probably get a PCR test as well. And that's just because last year it didn't seem like we really had those things, those illnesses. I think because we were all wearing masks still. At this point, there aren't a lot of mask mandates in general, and so I think it is important that we do know that we see other cold viruses that are going around, but also we know coronavirus is very prevalent. So if there are symptoms, the best thing to probably do is go get tested.
Okay, doctors have shared warnings about an animal medication, Ivermectin, being used off-label by people to combat COVID-19. I know you all plan to talk about this today on the daily University of Kansas Health System COVID-19 briefing, and we've heard that we have seen this locally
Poison
as
control
well.
Being called, that kind of thing, yeah.
Let's just take a second here and break some things down because, doctor, there is a version of Ivermectin that is approved for use in people, but not to treat COVID-19, right?
Correct, and ivermectin is a very good drug for what it's used for, and it's to clear parasitic infections from humans or animals. So when it's used in that sense and in that way, the way that it's approved for, it's a very good, safe drug. But if you are using it not in those ways, you can get toxicity from it. And again, you're just using a drug that you otherwise don't need. We know that people don't want to get a vaccine that has been very well vetted as far as safety and efficacy. They don't want to take that, although it's safe, but yet they will roll the dice and try to take this other medicine, and probably not even in adult formulations, but maybe animal formulations, as you talked about. So it's kind of astounding to understand and think about that. Frankly, for a drug that I don't even really see a mechanism of action for working against coronavirus. I'm happy to look at all the clinical studies, and if the clinical studies do come back and say that it does work and it's beneficial for treating or protecting against coronavirus, we'll certainly accept that. But right now, the consistent, well-vetted, and peer-reviewed data do not support that at all.
And what's the danger in taking, apart from the fact that it's not been approved to treat COVID-19 and you don't believe it will help?
You mentioned toxicity, but what can happen here?
For a dose meant for animals or horses.
And again, and that's what I understand is too the stuff that you do buy at some of the feed stores or the animal stores, different concentrations. So again, ivermectin is a fairly safe drug, but that's when it's taken in the correct amounts. If it's taken in higher amounts, certainly the more common kind of toxicity is what we call neurotoxicity or central nervous system. So having to do with your brain or your spine, just creating toxicity in that way so that you aren't functioning normally. Mostly it's transient, but it still makes you very ill and can cause those bad side effects.
And you haven't seen anything that would suggest to you that right now there's a version of ivermectin that is a good idea to use to treat COVID-19. You've seen nothing that would suggest that for you so far.
No, and we know those papers are out there, those medical papers that say that it does benefit. But when you really parse them down and get granular about the details, you find a lot of limitations and problems with those studies. The best studies that we do have show no benefit at all from taking ivermectin, either to help protect you against COVID-19 or to treat COVID-19. And in general, I don't see a true mechanism of action as to why that medicine would work on COVID-19. Again, it's an anti-parasitic drug. And we know that we use other things off-label for COVID-19, such as steroids or some of those other antibody treatments like tocilizumab. But those are in those extreme cases, and they have a clear mechanism of action of what we're trying to treat and what we are trying to help at that point in the course of treatment.
Really important information. Dr.
Yes,
Hawkinson, thank you very much.